Welcome everyone. My name's Emma Suggett and I'm a pharmacist working for the West Midlands Academic Health Science Network. Thank you for taking the time to view this video. There are 15 AHSNs in England, which are organisations commissioned by NHS-EI to support the implementation and adoption of innovation into the NHS. Transfer of Care Around Medicines, or TCAM, is just one of the many projects and innovations we are commissioned to deliver nationally. So I've spent the last 2 years supporting systems across the West Midlands in getting this e-referral pathway up and running. This video is to articulate an update of TCAM at Q4 2020 to 21. It's applicable for all stakeholders across the West Midlands in all pharmacy sectors. This video webinar includes a number of updates for the West Midlands, and due to the pressures on everyone's time imposed by the ongoing pandemic, each update is being made available as a separate video, which you may watch at your own convenience. The videos may be watched if you're interested in all items on the agenda, or as a standalone video if you only have time to access the agenda item which is pertinent to you. Each agenda item has a link to the recording and has been circulated with its associated slide deck. There's now a large amount of evidence nationally that those patients identified by hospital pharmacy teams as requiring additional support with their medicines benefit from a conversation with their community pharmacist when information is referred electronically. Those patients can then be supported by their pharmacist in the weeks following discharge to reduce the likelihood that they are readmitted due to a medicines-related issue. This e-referral pathway is known as Transfer of Care Around Medicines, or TCAM, and from the 15th of February, TCAM will launch in community pharmacy as the Discharge Medicine Service, a new essential service which in the main will be synonymous with TCAM. Across the West Midlands, in the main, we will mainly be using Farm Outcomes as our e-platform. So briefly to update you where we are with TCAM. Nationally, almost 50% of acute trusts now refer through TCAM on discharge. Over 99% of these trusts use the electronic platform Farm Outcomes for their referrals, which is the same platform used for referrals to the Community Pharmacy Consultation Service by NHS 111 and now GPs, and for the documentation of NMS and flu services. The situation in the West Midlands reflects the national picture, with the addition that we have not limited TCAM to acute trusts and have a couple of community trusts who are also live. This map shows our 13 live trusts, all of which are referring using Farm Outcomes. There are a further 4 trusts who are likely to go live with TCAM before the end of March 2021. Currently, the trusts are limited to referral to pharmacies within their locality, but from the 15th of February, they will be able to refer to any community pharmacy using Farm Outcomes in England. It's therefore possible, particularly if you are a community pharmacist on a regional border, that you could receive a referral from a hospital outside the region. However, all trusts using Farm Outcomes will make referrals using the same standards and contractors will be paid in the same way, irrespective of where the referral originates from. What may cause more of an issue are those trusts who are not yet live with Farm Outcomes or have made a decision not to use the Farm Outcomes platform. In terms of acute trusts who have yet to engage, currently these are mainly in Birmingham and Solihull STP. These trusts are, however, permitted to send referrals via NHS.mail, but as yet, should they do so, it's not clear how contractors would be remunerated for the activity, whilst payment for referrals documented on Farm Outcomes will be through a direct link with the BSA. If you're interested in further information about the DMS, please listen to the video agenda item outlining this service. In terms of how many referrals hospitals are currently sending in the West Midlands, this table shows how varied the current numbers are. It's highly likely that there will be an acute hospital CQUIN, a commissioning for quality and innovation payment for acute trusts beginning in April 2021. Please view the video agenda item regarding the CQUIN if you'd like to know more. What's really encouraging across the West Midlands is that we, with just a few exceptions, have a very high completion rates in community pharmacy. When TCAM was first piloted in Newcastle upon Tyne, completion rates were only 36%. So you can see that most of our completion rates are well over 70%, despite the current operational stresses on community pharmacy services. As an essential service with associated payment from February, we are expecting completion rates to increase even higher. We also have 9 trusts who were successful in their bids for the cost of a farm outcomes licence to refer to clinical pharmacy teams supporting care homes. 2 trusts are already live with referrals supporting care homes in Shropshire, while the others are working through mapping care homes to the clinical pharmacy service supporting them and completing internal approvals. Should you be interested in finding out more about this service, please view the video agenda item outlining TCAM to support care homes. Finally, I must let you know that this will be the final quarterly TCAM update from the AHSN. From the 1st of April, NHSEI is no longer commissioning our support for this workstream. The decision has been based on the fact that contractual arrangements such as the new DMS for community pharmacy and the adoption of the CQUIN by Acute trusts should ensure sustainability of the infrastructure supporting referrals which we've built up over the past few years. In practice, what this means is the West Midlands AHSN will provide no further funding for farm outcomes licences and will not be providing further comms regarding the service. Our role will be of an advisory and signposting nature only. Ongoing contacts can be found on this slide. Kevin Noble is the most appropriate contact to discuss setting up a new referral pathway in farm outcomes, while the help desk available from the farm outcomes systems is the most appropriate contact for adding or removing TCAM users and any other issues that you might have with farm outcomes reports. So finally, just a signpost you to the further agenda items. Please click on the respective link to be taken to your next chosen agenda item. Many thanks for listening to this introductory video.